Thank you so much, Steph. Good morning, everyone. I'd like to start by walking you through today's data. The current 7-day daily average of cases is about 240,400 cases per day, an increase of about 60% over the previous week. The rapid increase in cases we are seeing across the country is in large part a reflection of the exceptionally transmissible Omicron variant. In a few short weeks, Omicron has rapidly increased across the country, and we expect will continue to circulate in the coming weeks. While our cases have substantially increased from last week, hospitalizations and deaths remain comparatively low right now. The 7-day average of hospitalizations admissions is about 9,000 per day, an increase of about 14% over the previous week. This could be due to the fact that hospitalizations tend to lag behind cases by about 2 weeks, but may also be due to the early indications that we've seen from other countries like South Africa and United Kingdom of milder disease from Omicron, especially among the vaccinated and the boosted. And the 7-day average of daily deaths are about 1,100 per day, which is a decrease of about 7% over the previous week. As you continue to watch these trends, I want to emphasize that this virus has proven its ability to adapt quickly, and we must adapt with it. And it is in that context that last week, CDC updated our isolation and quarantine guidance for healthcare workers as we prepare for an anticipated surge in COVID-19 cases. This updated guidance will help to ensure that hospitals, clinics, and long-term care facilities can safely stay open and remain appropriately staffed, both to handle hospitalizations from COVID-19 and to make sure that we continue to provide the necessary care for those experiencing heart attacks, strokes, and other illnesses. Swiftly thereafter, on Monday, CDC also updated its recommendations to shorten the recommended isolation and quarantine period for the general public. These updates to our recommendations were made to reflect what we currently know about COVID-19 infection, including how long a person is most infectious. Studies have demonstrated that when infection with SARS-CoV-2, people are infected with SARS-CoV-2, people are most infectious in the 1 to 2 days before symptoms develop and the 2 to 3 days after. After 5 days, the risk of ongoing transmission substantially decreases. Let me make clear that we are standing on the shoulders of 2 years of science, 2 years of understanding transmissibility, and a lot of information that we have gleaned from the wild type virus, as well as the Alpha and Delta variants, and more that we continue to learn every single day about Omicron. We do know the vast majority of viral transmission happens in those first 5 days, somewhere in the 85 to 90% range. So if a person can isolate for the first 5 days, they absolutely should. Many are asking, why do we not require a test at the end of the 5 days of isolation for those who are infected? We know that PCR testing would not be helpful in this setting, as people can remain PCR positive for up to 12 weeks after infection and long after they are transmissible and infectious. We also don't know that antigen tests give a good indication of transmissibility at this stage of infection. On the other hand, we know that after 5 days, people are much less likely to transmit the virus, and that masking further reduces that risk. And this is why people need to mask for 5 days after their 5 days of isolation. This science, as well as what we know about the protection provided by masking, vaccination, and booster doses, and about our test performance, were all part of what informed our updated recommendations. Let me walk you through exactly what these new recommendations mean for you. First, isolation refers to what you do when you have COVID-19, most likely diagnosed by a positive test. Isolation prevents those who are known to be infected from transmitting the virus to others. Quarantine, on the other hand, is different. This is what you do when you've been exposed to someone who has disease and are unsure if you yourself were infected. Quarantine prevents further spread of the virus in the time before someone may develop symptoms or from those who are asymptomatic from their infection. If you are infected with SARS-CoV-2, regardless of your vaccination status, you should isolate for 5 days. During periods of isolation, it's best for you to wear a mask around those in your household to avoid spreading the virus at home. After 5 days, if you're asymptomatic or if your symptoms have largely resolved, you may leave isolation as long as you continue to wear a mask around others, even in the home, for an additional 5 days. For those who've been exposed to COVID-19, quarantine recommendations are based on your vaccination status. If you are boosted or have been vaccinated with your Pfizer or Moderna series in the past 6 months, or your J&J shot in the past 2 months, no quarantine is needed. However, a mask must be worn for 10 days following your known exposure. And we also recommend getting a test on day 5 after your exposure. If you're not vaccinated, or you were vaccinated with your Pfizer or Moderna series over 6 months ago, or with J&J over 2 months ago, and have not yet received your booster, you should quarantine for 5 days following your last exposure. After 5 days, you should continue masking around others for an additional 5 days, and you should also get a test at day 5. If it's not possible for you to quarantine, it is really important that you do the right thing and wear a mask at all times around others for 10 days after your exposure. Here, we also emphasize that you should get a test at day 5. And if at any point you develop symptoms of COVID-19 during your quarantine period or your 10 days after exposure, like fevers, runny nose, a cough, headaches, or body aches, you should get a test and isolate until your test results return. And of course, then isolate if your test returns positive. Now, with these updates to our isolation and quarantine recommendations, I want to emphasize the critical importance of masking, which we know decreases the risk of transmission, as well as the importance of staying home when you're sick. If you are sick or have symptoms, it is best for you to stay home and to stay away from others. As we continue to fight COVID-19, prevention is truly our best option. This means for everyone getting, and for those eligible, it means getting your booster. And it means continuing to follow our multi-layer prevention measures, including masking in public indoor settings in areas of substantial or high community transmission, washing your hands frequently, and testing before gathering when possible. How well each of these prevention measures is implemented, as well as adherence to isolation and quarantine recommendations, will determine the outlook in the coming weeks and months. We at CDC are working to provide updated recommendations using science to ease the burden of lengthy isolation and quarantine recommendations. However, these recommendations will only work if people follow them. As we look to the new year, I am hopeful that we can come together and do what is in the best interest of our loved ones, our friends, and our communities. So with that, I say thank you, Happy New Year, and I will now turn things over to Dr. Fauci.